ever worried about your baby's feet, which seems to be appearing flat? Wondering what you can do to help improve them? Is it really likely to improve on its own? Are there likely issues of pain or discomfort that your child may face in later life? What about using insoles or arch support? Is it really worthwhile? All these queries and more in today's video on Flatfoot in children. There are numerous musculoskeletal issues that a child may face on his journey to adulthood. Through this channel, we aim to spread parental awareness regarding bone, joint, and muscle health in growing children so that treatable conditions can be managed in a timely manner. Hello friends, I'm Dr. Ratna Maheshwari, Pediatric Orthopedics Surgeon at Enable, Mumbai. Today, let's discuss this topic of flatfoot in children. So what is flatfoot? What does it look like? Well, if you look at the feet of these children, then from the inside along the big toe, it appears that the arch is depressed. From behind, the heel appears to be tilted outwards. But most babies are born with flat feet. The arch often spontaneously develops in the first decade of life. Statistics say that of all children having flat feet, 1 in 5 may still never develop an arch. And we are often asked the reason for why the arch doesn't develop. It could be a genetic tendency, it may be running in the family. Other reasons include obesity, joint or ligament laxity, or some underlying condition like neuromuscular issues, cerebral palsy, etc., and that needs further evaluation. However, these children with persistent flat feet will still function normally and have strong, pain-free feet as adults, provided it's a flexible variety, and we'll come to that later. Just as the height of children of the same age vary widely, the height of the arches too vary in a wide spectrum of what is considered normal. So if your baby's arch is going to develop spontaneously, do you still need to visit a specialist? The answer is yes, and here is why. There are some rare varieties of flat feet which can be problematic. Hence, it is better to be screened and diagnosed early. For example, some newborn babies are born with a condition in the foot called congenital vertical talus. The foot here has some misalignment in the bones and it appears boat-shaped. They can often be mistaken for being flat feet, but this condition needs early evaluation and management. Some flat feet are associated with a tight heel cord. There is a muscle called gastrosoleus which runs behind the shin and inserts on the heel. If there is tightness of this muscle and if it is associated with flat feet, then this variety tends to be painful. Hence, early diagnosis and physiotherapy are likely to be helpful. Some variety of flat feet are known as the rigid variety, and this can be tested by your specialist on the basis of how the arch recreates when the child is on the tiptoe. The picture shown here is of the flexible variety. One can see in the picture on the left, when the child is putting weight on the foot, the arch appears flat, but when asked to stand on the tippy toes, the arch gets created. In the rigid variety, whether the child is weight bearing or on the tiptoes, the arch is always flat. The rigid variety of flat feet have abnormal connections between bones of the foot, which restricts its mobility and gives a flat appearance to the arch. Coming to the role of insoles or arch support, there is no conclusive evidence to suggest their use in helping to form the arches. However, they may be trialed in a child having issues of discomfort or shoe wear and tear. There are a variety of insoles available in the market, soft ones and firm ones. Again, the prescription is based on the type of flat foot your child has. Please note that this video is purely for educational purposes. It is by no means a replacement for actual physical consultation and advice. So friends, I hope you found this video useful and informative. If you did, kindly like, share and subscribe to the channel and encourage us to spread more awareness on bone, joint and muscle health in children. Active, healthy kids are happy kids, and we are thrilled to be a part of this journey with you. Thank you.